All right, thank you for staying with the Monday Report. The conversation begins right now. We are calling it State of Health Care, and with me in studios His Excellency Mudomi Njuki is the governor for Tharaka Nithi, but is also the chairperson for the Health Committee and the COG. Thank you so much for making time. And Dr. gov't, who's the Secretary General, Kenya Medical Practitioners and Dentists Union, that is KMPDU. Asante sana for making time. Their 60-day strike notice lapsed yesterday, so they're expecting a government conversation tomorrow. But Davji, before then, has there been any progress after you suspended your strike for 60 days?
First of all, Trevor, to start, I will say that on 27th of July 2022, we were at Health Economic Forum, presided by the then Deputy President of the Republic of Kenya, where he told us to take photos. And one thing that he said is that he will be the negotiator between the Council of Governors and the healthcare workers. On 14th of February, we were at the State House, where the President reiterated his commitment to ensure that every Kenyan have an access to healthcare, his commitment to ensure that there are no industrial actions in the country, and his commitment to ensure that the CBAs are implemented. On 4th of January, we sat with the Council of Governors, with the Ministry of Health and the Ministry of Labor, and agreed on a framework to ensure that the CBA that was signed in 2017, that runs between 2017 and 2021, is fully implemented. And I will tell you, up to date, we've been waiting to be given the report of the multi-agency committee that was sitting. We wrote to the ministry, we wrote to the Council of Governors to get reports for the same, and that has not been done. But that particular CBA, we took it to court. And on 20th of October 2021, the court made a directive to all the 47 governors, to all the ministry of Health, that they had to comply with the court order. Again, on the part 5 of that particular court ruling or judgment, the court said that in the event that the governors do not comply and the ministry do not comply, then the doctors to proceed on industrial action. So it then means that if the government has not complied to this, almost 480 days later, then it means that we have to comply to the court order by proceeding on industrial action. That means if any doctor fails to go on that strike, if the government fails to implement the CBA, it will be considered contempt of the court.
Okay.
Yes.
Governor, what is the progress?
Well, you know, first of all, let me say I'm glad to be here, and I'm happy to see my friend doing his job. You know, he's employed by the Doctors Union to make sure that he argues for them and ensures that they have their rights. We need the doctors, all right, but we always have to be factual and truthful to each other. So when he's talking about the CBA, you know, that's a very complicated word to the people who are listening, especially because the common point where we meet are the patients. It is important for you to tell these patients, what is this CBA? What is it was in the CBA that has not been honored, you know, instead of just putting blanket CBA. So what has not been honored? And I would like him to respond to that before I make my comment. Okay.
One of the issues of the extreme shortage of doctors, nurses, and all the service providers in the counties, they say there's unemployment amongst healthcare workers. Those who exist say that they are paid very poorly. That's just part of what was there that you're asking. Is this true, and how can it be addressed?
Well, I am not very sure whether that was part of the CBS per se, because you cannot measure how many doctors. They had not said how many doctors to be employed. I know one of the issues they addressed in the CBA is that they would like all the doctors that are fresh from the university to be placed somewhere on what you call internship. And as far as I'm concerned, last month we released funds, the national government. It has already been announced, and I would like him to confirm that we have now absorbed all the doctors that were coming from fresh from college to put them in the place with them on internship. This CBA definitely had allowances since the 2017. It is important for him to acknowledge that all the allowances have been paid for, and I do not have to give figures here. The only issue that is in contention is the basic pay, which is why they went to court. And the basic pay is a matter that is normally set by SRC. They did agree, yes, the doctor should be paid. However, it is important to note that the job group of a doctor is not different from a job group of an accountant, a job group of an engineer. And therefore, for us to implement that, it is important to note that we need the Public Service Commission to be able to anchor that in what we call the IPPD, so that you can be able to get a code to pay these gentlemen and ladies who are doing a very good job. However, since this matter is before a reconciliator who is supposed to be delivering a verdict tomorrow, and again he has mentioned very clearly that is in court, it would not be proper for us to preempt what will happen tomorrow. So on the matter of the CBA, I would prefer that we rest the issue of what is going to happen tomorrow there, so that we wait. In fact, I was wondering why he chose on a day like today, because you cannot come when you have a court ruling tomorrow, and then you come and discuss the matter the day before.
Tomorrow is it a court ruling? You're just meeting?
No, I'm just giving you an example.
Yes.
We have someone who is supposed to be reconciling us.
Yeah.
We have been having not exactly a standoff, just a good conversation around how we can make sure that our people continue receiving services. So we'd like to wait for tomorrow and see what will happen. But we can discuss other issues of employment.
Okay.
I want to start by telling you that since the advent of devolution, we've seen increased employment of medical doctors in this country. We started with 56,000 in the whole country in 2013. Today we are talking about, actually there were 59,000. Today we are talking about 96,000 doctors. That's an increasement of 61%. Remember that the national government only has 6 facilities, which we normally call level 6. So all the doctors that we are talking about here, apart from the 1,300 that are in the referral hospital, the national referral hospital, the 6 of them, all the others in the counties. We have seen increase in the number of employment in doctors in the counties from that paltry number of 59,000 to 96,000, because figures don't lie.
Okay.
It is also important to note that we have a better distribution than we had before. Initially, when we had this service domiciled in the Ministry of Health, overseeing the whole country from Afia House, we had a situation just exactly the one we had with teachers before we had this issue of decentralization, where the marginalized counties, what we call the most rural counties, doctors don't want to work there, because definitely we have an environment that does not allow a lot of flexibility in terms of having other extra hours to work in for probably other hospitals, other health facilities, and also of course the environment that they work in. And therefore they have been choosing to work around Nairobi and the environment. That is why today, if you look at the counties that surround the former provincial headquarters, most of the doctors, when they were devolved, they are found in those counties in very big numbers, where the rural counties had almost nothing.
Okay.
And therefore most of those employment took place in the rural counties. And the health indicators, by all means possible, both by the two bodies that usually look at whether the health indicators are improving, shows that health has improved since 2012. And you do not want to change a winning formula.
All right.
There's better healthcare as compared to what we had in 2013.
Okay, so gov't, what is the issue if all these things have been addressed, the governor is saying?
I would say that...
let's start with the employment of the doctors. Have they been absorbed?
You know, the reality is that when the governors cannot admit that the public healthcare in the counties is dysfunctional, then that's why I believe when the president and the national get difficulty.
Before we get there, let's just set the record straight. Have the interns been absorbed?
I'm giving you part of the unemployment. If you look at the unemployment since independence, it is the first time that we have more than 4,000 doctors. We have more than 10,000 nurses. We have more clinical officers that are unemployed in this country ever since independence. And this started in 2017, when then the chairman of Health Committee was Dr. Onongwai, who actually posted and said, well, the doctors were posted, the pharmacists and dentists from the Ministry of Health to different counties, and they rejected a big number of doctors in the county, and they say they do not have budget and they cannot manage to employ. Since 2017 to 2023, we've had 5,340 doctors graduating in the country, and the counties have employed only 1,000, meaning some counties are employing 2 doctors, some have gone without any employment. Today, if you go to the hospitals, you will take 24 hours or more than 10 hours to get to see a doctor. Most of the sub-county or level 4 hospitals in the country If they're lucky, they have the sub-county MOH. They don't have doctors in the facilities. And that is the scenario. It's a frustrating scenario for the doctors who are in those counties, and more frustrating for the wananchi who can't get these services.
But have the interns been absorbed? Let's start from
the interns were absorbed, and that was about 80% of them.
Have the allowances been paid?
Not yet. And it's a plan that they will pay. They say they'll pay them in the month of April. But
has there been an increase of employment of doctors by 61%, like the government?
There's been a reduction in employment of doctors by more than 80%. Because in 2017, you were graduating from the universities and being employed, because there's an extreme shortage in every facility in this country. And that's why today you will realize that most of the Kenyans, according to the Infotrack statistics, 72% of Kenyans go to the hospitals, but only 30% are able to get services.
Okay.
Why? It's because majority, and you've seen this in the papers, you've seen this around, that we have 4,000 doctors unemployed in a country that there's shortage in the facilities. If you compare our numbers of doctors to South Africa is 5 times our numbers in terms of doctors.
Yeah.
But then they have all the doctors employed.
Okay.
They only had 200 who were employed in December. By February, they're all employed.
Okay.
In Kenya, we have many of them unemployed. And those who are employed in the counties are frustrated to the point that specialists are leaving the hospitals because they have salary delays that is consistent every month.
Okay.
They have not received promotion, some 10 years, some 15 years. The some that go to the hospital and they do not have equipment. You have seen hospitals where a patient comes to the hospital, there's no intensive care. Even if there are 10 doctors, they will not get the services.
Okay.
Yes, those are the scenarios that are happening in the county.
So this is a multifaceted issue, Governor, and one of the things he's talking about is delayed salaries, promotions, but also there's lack of medicine in some of the county governments. What is the strategy to improve on this?
Well, we have a convergence and division point with my friend Davji.
Yeah.
He never addressed himself to the situation between 2013 and 2017. And I would like to give you an explanation. He should actually be able to admit that we have had an increase in doctors from 2013 to 2017. And we admit, yes, there has been slow absorption of doctors from 2017 to date, and we have very good reasons for that. First and foremost, let's acknowledge that at the moment we are absorbing all the graduates that come from university internship. We give them internship. So internship, we are up to date. They actually get an opportunity to practice before they get posted to wherever they have to get posted to. However, I want you to realize that before 2013, there are very few universities in this country which used to offer medicine. We had Moi University, Nairobi University, and to date, almost every other university that was inaugurated or given a charter in 2013 is offering that course in medicine. And therefore, you've increased the production of doctors. It is just the same way we used to have with teachers, where when you leave university, you used to be posted directly. Today, we have more than 30,000 graduate teachers who are jobless. Why? Because we produce more than we can actually be able to absorb. So the medical field is not very, very, very different. However, our margin is very small. Because from 2017, around 2017, we have more doctors coming out of the universities that we can actually be able to absorb at a go. And secondly, you remember very well in 2017, we had a moratorium by the president, and he gave instructions to the Public Service Commission that we slowed down on employment. That is known to all the Kenyans. However, counties are still employing on a need-to-need basis, depending on whether you have attrition, whether some have gone to college. And it's important to note that I have never seen a situation where doctors are lucky like Kenyan doctors. You can imagine that a doctor normally reports to a new station, and after 3 years, they are normally given a study leave to go and study when they are being paid their salaries in full, and that study is normally paid for by the government. And sometimes even when you complain, you should be able to count your blessings. People tell the patient that the Kenyan government pays for your studies, that you don't pay for them. When you're studying, we are paying you salary. And I can give you a very good example in Tharaka Nithi County, because I don't want to talk about other counties. I have a total of 26 doctors. As we talk, 13 doctors are on study leave, and I'm paying them salaries. So the money I would have used to hire other new doctors when these 13 are on study leave is the one I'm using to pay them salaries. So why will I not have a shortage? So we need a remedy. These doctors should be able to tell us when they go on study leave, they should actually be able to maybe be on half pay, because actually, if you're on study leave, you may not be having the same needs that you're having when you're very actively involved. You know, when you're a student, it's not the same as when you're a family man at home. Your needs normally reduce. But we've been generous enough to ensure that they get paid. So they cannot have their cake and eat it. In Tharaka Nithi today, if you ask me to employ another 13 doctors, where will I get the money to employ the other 13 doctors as I wait for the other 13 to come back? When they come back, it means I'm going to have double the number and the resources are still the same. So that is what has been one of the biggest problems, and which I am not having any issue with empowering our doctors.
Yeah.
Because when they get a study leave, they come back as specialists, and actually their job even goes up, and we continue having better services. But you should be alive to the fact that the economy is not growing at the same rate as our needs that we are talking about here.
Okay.
Yeah.
Trevor, if you look keenly in the counties and the situation that is in existence in terms of the personnel that they have and the services that they ought to offer, then you will realize the big gap that is in existence. And I've liked the way the Excellency has explained that when the doctors go for training, you know, they go to training in public facilities like in KNH. And the medical training is not like the training where you go to class. You actually train by working in the hospitals. That was happening in KNH, in MTRH, and QTRH. What has come over time, over the period, and that is a fact, and that's what we see, that counties now rely on the Ministry of Health posting for them interns, because these are intern trainees that are paid by the Ministry of Health. It's not from the money from the counties, and they accept. Right. We have the UHC doctors and healthcare workers who are all posted down to the counties on a very poor terms, by the way, which has made a lot of frustrations to this particular universal healthcare workers. Okay. And one thing is that they're paid half the cost of other workers. There are also doctors and other healthcare workers who were employed on December 2021 by the Public Service Commission, given to the Ministry of Health. They've been posted downwards. So the reality is that counties, as it is now, will not manage the human resource of healthcare. Counties are specialized on procurement. They will do very well. Counties will do very well in construction facilities because that's what the Kenyans will see. But having level 7 or 7-star hospital in a county without healthcare workers, what is the benefit of it? Okay. That is the scenario that Kenyans are facing in the hospitals every day. All right. And therefore there is great need for the governors to actually acknowledge the need to have the human resource aspect of healthcare given back to the ministry or given back to the national, so we can have health service commission that will ensure that they do not overburden themselves and thinking that some doctors are specializing for training, that the doctors have not been employed. They will just be demanding, we need 50 doctors in Tharaka Nithi. Therefore, he just requests for, I have a request for that. We need 50 doctors in Tana River, everywhere.
I have to take a quick break, Dav. When you come back, we hear what governor has to say about that, plus your views coming through. Let's take that quick break. We're back in a short while.